morning. We're here at Mediheal Groups of Hospital to talk to a pediatrician here about breastfeeding. This is our breastfeeding week, and we are here with Dr.
I'm Dr. Mohapatra. I'm a consultant pediatrician here.
Thank you very much. And we are going to find out the benefits of breastfeeding and anything else related to the breastfeeding with the mom. So I would like to ask, first amongst our questions, what is breastfeeding and how do we breastfeed when it comes to the child and the mother?
Okay, breastfeeding is something like, breast milk is called the amazing milk or a liquid gold, which actually the mother with all her love and affection, she gives to the child. Okay,
Mm-hmm.
So
how would you differentiate between the breast milk, the cow milk, and the powdered milk that most children get at sometimes at the infancy stage?
yes, actually breast milk, it has got the sufficient amounts of the protein, the carbs, the fats, and the energy which is required, and for the child, for his normal development, normal growth. Okay, whereas cow's milk, though it is way too better, but is not meant for the newborns. It is meant only for the adults, or after 1 year of age you can start with cow's milk. Okay, and powdered milk, as I say, powdered milk is something like, it has, though the various companies are there, they tell about like we have this much amount of this and fats and MCT and all those complex things, but thing is that in mother's milk, what happens is that she has got all the adequate proportion of proteins, fats, vitamins, energy. Okay?
And that is all in the mother's milk.
Yes, and moreover, it has got something else called immunoglobulins. Immunoglobulins, there is M, there is G, there is A.
So
Okay, all that. It is being passed on to the child for the mother.
So basically you find that is lacking in the cow's milk and the powdered milk.
Yes.
There's no way the powdered milk can be manufactured to include those.
Cannot be immunoglobulins. It is.
It's naturally found in the
It is
mother's
naturally. It
breast
is
milk.
the
What
basically.
she's taken.
So it is basically the immunity which the mom developed in her lifetime. She gives on to the child to the breast milk.
Okay, that's good to know. So the better milk is definitely the breast milk.
Yes.
Okay then. What would you say is the storage when now someone is working? You know, sometimes you can't be home all the time, and maternity leave is not for the whole year. So in storage of breast milk, because nowadays we have the breast pumps, and now you can store milk. What is the process? What is the required timeline?
So breast milk can be stored in room temperature, expressed breast milk actually, which the mom should express. Okay, and she can store it for 6 to 8 hours. Okay,
6 to
8 hours in open. Yes.
In the open.
In the open, yes.
What
And 24 hours inside a refrigerator, and she can refrigerate it or freeze it at minus 20 degrees Celsius for almost 3 months. You can keep it, will be safe.
So if I'm just leaving it on the table, it can be for 6 hours, 8 hours.
6 to 8 hours, yes.
In the fridge, 24 hours.
Yes.
Then now cold freezing it, the one that becomes stone.
It's like it's like an ice.
That is for 3 months.
For 3 months. But we should remember one thing. Once the milk is been frozen in the refrigerator, we should not remove it frequently. Like we should warm it in out. It should not be done because it will lose all the nutrients with that. So if we are freezing it, then we should just remove it once, and we can just
use it.
We can warm it, and we can feed the child and just carry on, finish.
So once the child doesn't finish it, you discard it. You can't put it back in the freezer for another 3 months.
We cannot.
That's not allowed.
That's not allowed.
Okay, and then the one for the fridge, in case you're putting it in the fridge for 24 hours, you feed the baby, it has stayed for like the whole day, you discard it. Don't put it back in the fridge.
No.
For another 24 hours.
No.
Okay, that's
Cannot
good
do
to know. What about pacifiers? You find a lot of children nowadays are being given the pacifiers. Do they really help?
Pacifiers, it's sometimes given to the fussy child. Okay, so that he just does not make any fuss about it.
So it's like a toy for the mouth.
It's toy for the mouth.
Just play with it.
It's just like if the baby is cranky and he is irritated, then you can just put something in his mouth and he'll be suckling and suckling and suckling it. But one thing is that once the child is introduced to pacifiers, he will seldom start to again on breastfeed, because on breastfeeding, child uses his muscles, okay, muscles, his trunk muscles, his jaws, okay, and he's doing a physical activity to suckle the mother's milk, okay.
So it's like also training.
Also training.
So how early can you give a pacifier to a child? Immediately after birth, or you give it like 3 months or 9 months? How long?
If I say you should not give it, okay.
Oh, according to you, you prefer the child not to have
It's
a pacifier.
never to have pacifier because see, during breastfeeding, child is himself trying to latch on, suckle the milk. Okay. 1 second. Hello. Yeah. I'm a little busy. I'll come in to 15 minutes. Okay. There's an interview going on. Okay. Okay.
So you would not recommend a pacifier you would not advise a mom to
use a pacifier. Actually, I want to educate mom about that. Like, we feel it very easy to just give a pacifier. The child will be quiet for some time. He won't be fussy about anything. But a pacifier, we're introducing sort of infection to his mouth. Okay, we can sterilize the pacifier 100 times a day. But are we sure that who does not know if it has touched the bed sheet or something, it's touched somewhere, and we're putting that directly in the mouth, which leads to sort of gut infection in the child, and he can have a rotavirus infection also. So it's a no. Okay, it should not be used.
But what if the child is teething and you're trying to avoid them from biting other things? They can't use the pacifier?
Okay, we can have something else also. We can at least in a home a sterile towel, a wash towel. Okay, we can make it wet, and we can put it in his mouth, and he can just chew on that and chew on that. Okay, instead of pacifier.
So basically, a pacifier is a no-no.
Is a no-no.
Okay, then good to know. We'd also like to find out about feeding bottles, complications associated with feeding bottles.
Now, feeding bottles actually is the same thing as pacifiers because for example, if a mom is going to work or she just gives a feeding bottle, child on feeding bottle. But as I remember, during my studies, when I was studying for my MD pediatrics, so we used to throw any feeding bottle if you see. Okay, so it was that serious. Like, it should not be allowed because it causes a rotavirus infection. Okay, and the same logic applies as it was in pacifiers, and the child can have a malunion of teeth. Teeth means if he's using a feeding bottle and he's putting in his mouth, then one teeth should be towards east and one towards west, like this. We don't want that.
Okay. So it will cause the teeth to go
malunion. Even the teeth will not be aligned properly. Like, we close the teeth, something will be back, some will be front, so it will ugly.
Cause more problems.
Yes.
Okay, good to know. But now, what happens because the mother is breast pumping the milk and then gives it to the child?
We can do something. We can have a bowl. We can have a small bowl and give her by a spoon. Okay. Now I just want to say, if I'm talking about breastfeeding, I should just tell the mamas there.
The best thing is just to breastfeed.
Just breastfeed, or else. If you are trying to, if you're sort of working and you have stored the milk, then you have someone in this home, okay, who can feed the child by a bowl and a spoon, okay. It is like you hold the child, you keep the child in your lap, okay, and his head should be propped down 30 degrees, okay. His head should be balancing on your hand, okay. You keep the child like this, and you start feeding him like this. By this, what happens is that the child will not be having a complication of aspiration. Yeah, because mostly what happens that the mama feeds the child when he is lying down on the bed, and he just starts pouring the spoon in his mouth.
So no, the child has to be propped up.
Yeah. His head should be balancing on your hand, okay, and you feed the child. It's going to work.
It's allowed. So basically, the known maternity leave for mothers is 3 months. So with a 3-month-old baby, you're allowed to use a spoon and feed?
No, a 3-month-old child, you should breastfeed, right?
No, yes, but now this is a person who has to go back to work, even on the 4th month. After 4 months, they're supposed to come back to work. So the baby is 4 months, right?
Yes.
So now you're saying no pacifiers and you're recommending no bottles.
No bottles.
So now the recommended thing is a spoon.
And
milk.
Yes.
So you prop the child of 4 months up and feed with a spoon.
A 4-month child, how big would be? Almost 5 kgs or something. Okay, it's a small child. Okay, you can just hold in his lap. It's allowed. You can do that. At least it's better to help him prevent the complications of aspiration or something. Aspiration.
Okay, next question. What is Aerophagia?
Aerophagia. Now, what happens is that Aerophagia is something like when the baby latches on and suckles on the milk. So with the milk, he takes in some air too. Okay. So with the air, when the air goes into the abdomen of the child, his abdomen bloats. It just bloats, and for that the baby can't sleep. He cries, and the stress papa mama thing. What happened? Why my child is crying? We just fed him. Why he's crying?
He's been changed.
He's everything. Okay. And they try to find out what happened, why is he crying, and baby will be not stopping or not sleeping, not letting his parents sleep. So it's something which is called burping. What is burping? Is that after you feed the child, okay, you remove the gas. Make sure, just learn this how it is done. You hold the baby like this. His abdomen should be on your shoulder. Okay. And what happens is tiny ones, they fold their legs. If you see that, you can notice that they fold their legs. They fold the legs. So you hold him like this, make his legs straight or her legs straight, okay? Make your hands like this, okay? And start doing like this pop, 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 pop. Like this until the child burps at least 5 times, okay? It can take 10 to 15 minutes, so don't worry. For one session of feeding, the child should be fed for 20 minutes. Okay? Why 20 minutes? Because initially the breast milk has 2 parts. One a foremilk, one a hind milk. The foremilk is more of a glucose and milk, and the hind milk is more of a fats and proteins and all those things, which is necessary for the development of the bones and the muscles and all those things. So a glucose water, a child requires that too, because it will keep the child active.
The energy.
Yes. So we should at least try to feed the child for 20 minutes in one stretch. After that, please do burping for 10 to 15 minutes. With that, what happens? The child will be sleeping comfortably.
No swelling stomach.
Yes, no swelling in stomach. He can sleep, and when he wakes up, he'll feed again. So
they tend not to feed again after the stomach starts swelling and they're very uncomfortable.
They start crying and they get cranky after that.
Any other position recommended for burping? I've seen mothers put them on their laps upside down.
Yes, it is possible. Yeah, like you can put the child on your lap, and please make sure that his abdomen is on your knees. Okay. And
then now you tap.
And you tap until they burp.
Severally.
Yes. Okay.
Good. Thank you very much, Dr. Mohapatra.
Thank you.
We have learnt a lot today about breastfeeding, and I'm sure if anyone else has a question or query, we will have the contacts available for you.